Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Ashwagandha, Asgand Nagori. Comprehensive Herbal Guide to Benefits, Uses, and Supplements. Table of Contents. Introduction. Botanical classification. Common names. Geographic distribution. Parts used. Chemical constituents. Traditional uses. Medicinal benefits. How it works in the body. Dosage and forms. Side effects and precautions. Modern research studies. Use in Unani and Ayurvedic medicine. Comparison with modern medicine. Conclusion. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Introduction. Asgand Nagori is the Unani name for the medicinal herb scientifically known as Withania somnifera, commonly referred to as Ashwagandha in Ayurveda. The name Ashwagandha is derived from Sanskrit, meaning smell of a horse, indicating the herb's traditional belief to impart the strength, vitality, and stamina of a horse. It is a small shrub with yellow flowers native to India, the Middle East, and parts of Africa, and grows well in dry regions. The herb has been used for more than 3,000 years in traditional systems of medicine, such as Ayurveda and Unani, to manage a wide range of health conditions. It is classified as an adaptogen, a group of natural substances believed to help the body adapt to stress, restore physiological balance, and support overall health. Traditionally, it has been used to improve energy levels, enhance stamina, and support physical performance, particularly in cases of fatigue, debility, and convalescence. It is known to support mental health, helping reduce anxiety, stress, and symptoms of depression, often by modulating cortisol levels and enhancing GABAergic activity. In Unani medicine, Asgand Nagori is often prescribed for nervous exhaustion, sexual debility, general weakness, and as a rejuvenator, Mukawi I Aza e Raisa, for vital organs like the brain, heart, and liver. The root of the plant is most commonly used in traditional formulations, typically in the form of powder, churna, decoction, jushanda, or tablets. It is recognized for its anti-inflammatory, antioxidant, immunomodulatory, and neuroprotective properties, based on both classical use and modern pharmacological research. Studies have shown its potential in improving cognitive functions, supporting thyroid function, regulating blood sugar, and enhancing fertility in men. Asgand Nagori has also been used in chronic conditions like arthritis, insomnia, and muscle wasting disorders due to its tissue-building, anabolic effects. It contains active compounds such as withanolides, alkaloids, and cytoindocides, which contribute to its therapeutic actions. In modern wellness and herbal supplements, it is often included for its adaptogenic support, especially in managing chronic stress and fatigue syndromes. The herb is generally considered safe when used appropriately, but high doses may lead to gastrointestinal upset, drowsiness, or interactions with sedatives or thyroid medications. Botanical classification. Kingdom, Plantae, plants. Family, Solanaceae. Nightshade family, also includes tomatoes and potatoes. Genus, Withania. Species, Withania somnifera. This plant belongs to the same family as many medicinal and edible plants, known for their bioactive alkaloids. Common names. Scientific name. With Withania somnifera. This is the botanical name used in scientific literature and pharmacognosy. English names. Winter cherry refers to the small red berry it produces, resembling a cherry. Indian ginseng, named for its rejuvenating and energy-boosting effects, similar to Panax ginseng, though it is botanically unrelated. Unani Urdu name. Asgand Nagori, commonly used in Unani Tib, Greco-Arabic medicine, and in South Asian traditional practices. Ayurvedic, Sanskrit name. Ashwagandha, derived from ashwa, meaning horse, and gandha, meaning smell, implying the herb imparts the strength and vitality of a horse. Arabic name. Al-Haba, As-Sauda, Al-Hindiya, roughly translated as Indian black seed, used in Arabic herbal texts and traditional formulations. Regional names used across cultures and languages. Hindi, Asgand. Punjabi, Asgand. Bengali, Ashwagandha. Tamil, Amukhara. Kannada, Hiramadina Gida. Telugu, Peneru. Gujarati, Asoda. Marathi, Asgand. These local names reflect its widespread use in Indian traditional medicine and folk remedies. Geographic distribution. Native to South Asia, where it has been cultivated and used in traditional medicine for centuries. Especially prevalent in India, Pakistan, Bangladesh, and Sri Lanka. These regions offer ideal climatic conditions for the herb's natural growth. Thrives in dry subtropical climates and prefers sandy, well-drained soils. Commonly grows in semi-arid and arid zones, making it suitable for cultivation in drought-prone areas. Due to its medicinal value, it has spread to other parts of the world and is now found in Africa, especially in eastern and southern regions with similar climatic conditions. The Middle East, grown in countries that value traditional herbal medicine. The Mediterranean region, naturalized in some parts where conditions mimic its native environment. In India, which is the leading producer and exporter of ashwagandha, it is widely cultivated in several states, including Madhya Pradesh, the largest cultivator of high-quality roots, Rajasthan, due to its dry climate and sandy soils, Punjab and Gujarat, also known for large-scale cultivation and use in herbal industries. The plant is also increasingly cultivated in herbal farms and controlled environments globally, especially in countries promoting natural and organic medicine. Parts used. Root, the primary and most therapeutically valued part of the plant, rich in active phytochemicals, especially with analydes, alkaloids, and saponins, used in powder, churna, decoctions, jushanda, capsules, and tonics. Traditionally used to enhance vitality, reduce stress, support immunity, and treat fatigue and reproductive disorders. Also a key ingredient in Unani and Ayurvedic rejuvenating formulations. Leaves contain moderate levels of withanolides, though less potent than roots, commonly used in topical applications for their anti-inflammatory and antimicrobial properties. In some folk traditions, leaves are applied to skin infections, boils, and wounds. Occasionally used in herbal teas or decoctions for fever and detoxification purposes. Seeds and fruits, less commonly utilized in mainstream traditional medicine, occasionally found in local or tribal remedies, sometimes used as an additive in formulations. The berries, fruits, are small, red-orange in color, and may be used in some cultures for laxative or emetic purposes. Seeds have been explored in experimental studies, but have limited therapeutic use in comparison to roots and leaves. Chemical constituents. With anolides, the most significant group of bioactive compounds found mainly in the root and leaves. Structurally similar to steroids, they contribute to a wide range of therapeutic properties, possess anti-inflammatory, anti-tumor, anti-stress, immunomodulatory, and neuroprotective effects. Commonly studied with anolides include withafferin A and withanolide D. Alkaloids includes compounds such as withanine, somniferine, tropine, and aniferine, known for their sedative and calming properties, helping in anxiety reduction and improving sleep quality. Withanine is particularly studied for its central nervous system effects. Saponins, particularly withanosides, which are glycoside derivatives of withanolides, help in enhancing immune response, reducing inflammation, and supporting cellular defense mechanisms. Also contribute to anti-stress and adaptogenic properties. Iron and choline. Iron contributes to blood formation, helps in treating anemia, and enhances oxygen transport in the body. Choline supports brain development, cognitive function, and memory retention. Flavonoids and steroidal lactones provide antioxidant properties that neutralize free radicals, help in reducing oxidative stress and regulating inflammatory pathways, promote cellular health, and offer cardioprotective effects. Other nutrients and compounds includes amino acids, oligosaccharides, and polyphenols, contributing to its adaptogenic nature. The synergy of these compounds makes Asgand Nagori effective for multiple organ systems. These bioactive constituents collectively make Asgand Nagori a multifunctional herbal remedy valued in traditional and modern integrative medicine. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Traditional uses. In Unani medicine, widely regarded as a mukawi, strengthener, used to enhance general body strength and stamina, commonly prescribed as a tonic for sexual debility and chronic fatigue syndrome, plays a role in nerve rejuvenation, supporting conditions involving nervous weakness or mental fog. Used in formulations like Majun Asgand and Habe Asgand for joint pain, Wajaul Mafasil, and muscular weakness. Considered a brain tonic, Mukawi Damag, improving memory, focus, and calming anxiety. Often used in post-illness recovery to rebuild physical energy and immunity. In Ayurvedic medicine, classified as a powerful rasayana, which means a rejuvenator or agent that promotes vitality, youth, and longevity. Used for managing vata disorders, which affect the nervous system, hence prescribed for insomnia, nervous exhaustion, and stress-induced conditions. Recommended in cases of male infertility, low libido, impotence, and erectile dysfunction as a vrishya, aphrodisiac. Given to malnourished children, elderly individuals, or those recovering from surgery or prolonged illness to restore strength and wellness. Used as part of daily health regimens in classical texts, like Charaka Samhita and Ashtanga Hridaya, for maintaining balanced bodily functions, doshas. Believed to balance stress hormones and nourish all datus tissues, especially Shukra Dhatu, reproductive tissue, and Majja Dhatu, nerve tissue. Medicinal benefits. Mental and emotional health. helps reduce anxiety and depression by lowering cortisol, the primary stress hormone, acts as an adaptogen, helping the body cope with physical and mental stressors, supports cognitive function by enhancing mental clarity, memory recall, and concentration, encourages natural sleep patterns by calming the nervous system, making it useful for insomnia and sleep disorders, physical strength and energy, promotes muscle growth, strength, and endurance, particularly beneficial for athletes and bodybuilders. Improves recovery time after intense physical activity or illness. Effective in managing chronic fatigue syndrome, CFS, by restoring physical energy and vitality. Immunity and general health. Stimulates white blood cell WBC production, thus enhancing the immune response against infections. Contains potent antioxidants like withanolides and flavonoids that neutralize free radicals. Helps in detoxifying the body and supporting organ health, especially liver and kidneys. Reproductive health. In men, it increases sperm count, motility, and testosterone levels, aiding in male fertility. In women, it supports hormonal balance, regulates menstrual cycles, and helps with polycystic ovarian syndrome, PCOS. Used traditionally as a fertility booster and aphrodisiac in both Unani and Ayurvedic systems. Anti-inflammatory and anti-arthritic. Exhibits strong anti-inflammatory action, helping in reducing swelling and joint stiffness. Acts as a natural analgesic, pain reliever, making it effective in rheumatoid arthritis and osteoarthritis. Helps in maintaining joint mobility and reducing dependence on NSAIDs, non-steroidal anti-inflammatory drugs. Anti-cancer properties. Laboratory research shows withafrin A, one of its key constituents, inhibits the proliferation of cancer cells, promotes apoptosis, programmed cell death, in abnormal cells, indicating potential chemopreventive effects. Still under active research, but shows promise against cancers of the breast, colon, and lung in early-stage studies. Diabetic support. Assists in lowering blood glucose levels by improving insulin sensitivity. Reduces oxidative stress in pancreatic cells, helping in better glucose metabolism. May reduce symptoms associated with type 2 diabetes, including fatigue and mood swings. How Asgand Nagori works in the body. Modulates the central nervous system, CNS, acts on the brain and spinal cord, promoting calming effects by regulating neurotransmitters like GABA, gamma-aminobutyric acid. Enhances mental clarity, focus, and cognitive performance, especially under stress or fatigue. Useful in conditions involving anxiety, depression, and insomnia due to its mild sedative and nootropic, brain-boosting properties. Balances the hypothalamus-pituitary-adrenal, HPA, axis. The HPA axis controls the body's response to stress by regulating cortisol and other hormones. Asgand Nagori normalizes cortisol levels, preventing chronic stress damage to organs and mood disorders. Supports the adaptogenic role by helping the body maintain homeostasis during mental or physical stress. Regulates hormonal activity. Influences thyroid hormones, particularly helpful in cases of hypothyroidism by improving T3 and T4 hormone levels. Enhances testosterone production in males, promoting reproductive health and muscle development. Balances female reproductive hormones, aiding in menstrual regulation and fertility. Boosts antioxidant defense mechanisms, stimulates the production of natural antioxidant enzymes like superoxide dismutase, SOD, breaks down harmful superoxide radicals. Catalase, converts hydrogen peroxide, a harmful byproduct, into water and oxygen. These enzymes protect body cells from oxidative damage, slowing down cellular aging and chronic inflammation. Dosage and forms. Churna, powder form. Dosage, 3 to 6 grams per day. How to use. Traditionally mixed in warm milk, water, or honey, and consumed preferably at night for calming effects. Benefits. Enhances sleep quality, supports reproductive health, and strengthens the immune system. Common use. Recommended in Ayurveda and Unani medicine for daily tonic support. Capsules or tablets. Standard dosage, 300 to 600 milligrams once or twice daily. Standardization, usually standardized to contain a specific percentage of withanolides, the active compounds. Convenience, preferred for modern clinical use due to ease of administration and consistent dosing. Purpose, used for stress relief, thyroid balance, muscle recovery, and cognitive health. Liquid extracts or tinctures. Formulation, concentrated extracts in water or alcohol base. Usage, typically 2 to 4 milliliters, diluted in water or juice, taken 1 to 2 times daily. Benefit, fast absorption, especially suitable for individuals with digestive issues or difficulty swallowing pills. Application, common in Ayurvedic syrups and herbal health tonics. Paste, medicated oil, external use. Preparation, ground roots or herbal oils infused with Asgand Nagori extract. Application areas, applied on painful joints, swollen areas, chronic wounds, or muscle cramps. Therapeutic use, helps in reducing inflammation, healing wounds, and alleviating skin conditions like eczema or psoriasis. Important note: always consult a qualified Ayurvedic or Unani practitioner, herbalist, or medical doctor before beginning Asgand Nagori in any form. Dosages may vary based on age, health condition, existing medications, and individual constitution, prakriti in Ayurveda. Not recommended for pregnant or breastfeeding women unless prescribed. Side effects and precautions. Asgand Nagori, Withania somnifera, is generally safe for most people when used in recommended amounts based on traditional and clinical experience. It has a long history of safe use in Ayurvedic and Unani medicine, but caution is still advised in certain situations. High doses may lead to unwanted effects, such as excessive drowsiness due to its calming action on the nervous system. Some users may experience an upset stomach, nausea, or gastrointestinal discomfort, especially if taken on an empty stomach or in large quantities. Diarrhea can occur in sensitive individuals, particularly when the herb is consumed in powder or extract form in excessive amounts. Pregnant women should avoid Asgand Nagori because it may stimulate uterine contractions, posing a risk of miscarriage or premature labor. Breastfeeding women should consult a healthcare provider before use, as the safety of Asgand during lactation is not well established. People with autoimmune conditions such as lupus, rheumatoid arthritis, or multiple sclerosis should be cautious, as Asgand may stimulate immune system activity. Individuals with hyperthyroidism should consult a doctor before use, since Asgand may increase thyroid hormone production and worsen symptoms. Asgand may interact with medications that cause drowsiness or affect the brain, including antidepressants, anti-anxiety drugs, and sedatives, increasing their effects. Always consult a qualified healthcare professional or herbal practitioner before using Asgand Nagori, especially if you are on chronic medication or have existing medical conditions. It is recommended to start with a low dose and observe your body's response before increasing the dosage gradually. Modern research studies. A clinical study by Chandrasekhar et al., 2012, involved a 60-day randomized, double-blind, placebo-controlled trial in adults under chronic stress. Participants who took ashwagandha root extract showed a significant reduction in cortisol levels, the primary stress hormone, reported improvements in anxiety levels, energy, and overall well-being compared to the placebo group. Neuroprotective effects have been demonstrated in animal rodent models. Rodents administered with Withania somnifera extracts exhibited enhanced memory, learning ability, and brain function. Protective effects were noted in models of Alzheimer's and cognitive decline. Research published in journals such as Phytomedicine and the Journal of Ayurveda and Integrative Medicine supports several therapeutic applications. Improved fertility in both men and women through hormone regulation and sperm quality enhancement. Anti-diabetic properties, showing reduction in fasting blood sugar and improved insulin sensitivity. Anti-inflammatory action, reducing markers like C-reactive protein, CRP, in inflammatory conditions. Ongoing clinical trials are investigating the herb's role in managing post-COVID fatigue, immune dysfunction, and respiratory recovery. Early findings suggest that ashwagandha may help in restoring energy and improving immune resilience in people recovering from viral infections. Use in Unani and Ayurvedic medicine. In the Unani system of medicine, Asgand Nagori, Withania somnifera, is classified as a Mukawi Asa, meaning it acts as an organ tonic that strengthens vital organs like the brain, heart, and reproductive system. It is commonly included in well-known Unani herbal formulations, such as Majun e Asgand, a tonic used to boost energy, stamina, and sexual health. Itrifol ustukudus, a compound formulation used for detoxification and improving digestion. In Ayurvedic medicine, ashwagandha is celebrated as a powerful rasayana, which means it is used as a rejuvenator and longevity promoter that enhances physical and mental strength. It helps in balancing the doshas, particularly vata, which governs movement and nervous system, and kapha, which governs structure and immunity. Ashwagandha is a key ingredient in several classical Ayurvedic preparations, including ashwagandharishta, a fermented tonic for strengthening and improving vitality; chayawan prash, a herbal jam used for overall immunity, respiratory health, and nourishment; Brahma rasayana, a formulation used to improve brain function, memory, and cognitive health. Comparison with modern medicine. Stress relief. Asgand Nagori acts as a natural adaptogen, helping the body resist physical and mental stress by balancing the HPA axis and lowering cortisol levels. Modern equivalent. Prescription anti-anxiety drugs, e.g., benzodiazepines, SSRIs, that chemically reduce anxiety but may cause side effects and dependence. Brain support. Asgand Nagori functions as a nootropic herb that enhances memory, focus, and cognitive function through neuroprotective and antioxidant effects. Modern equivalent. Synthetic cognitive enhancers, e.g., pyracetam, modafinil, used to improve mental performance, but may carry risks and require monitoring. Pain relief. Asgand Nagori provides anti-inflammatory and analgesic effects naturally, reducing joint pain and swelling in arthritis without harsh side effects. modern equivalent, non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, that offer rapid relief but may cause stomach irritation and other side effects when used long-term. Fertility aid, Asgand Nagori, acts as a natural hormone modulator, improving sperm quality and balancing female reproductive hormones with fewer risks. Modern equivalent, hormone therapy that involves synthetic hormones or drugs to treat infertility, but can have significant side effects. Immunity booster, Asgand Nagori, functions as a herbal immunomodulator by enhancing white blood cell activity and antioxidant defenses. Modern equivalent, immune supplements like vitamin C, zinc, and immunostimulant drugs, which may lack the broad adaptogenic benefits of the herb. Conclusion: Asgand Nagori is more than just a traditional remedy. It is now validated by modern science, offers multi-system benefits, especially for mental health, immunity, strength, and chronic diseases. With its low toxicity, it is a valuable herb in preventive healthcare and complementary treatment. Students, researchers, and health-conscious individuals should explore its full potential under qualified supervision. Thank you so much for watching. Don't forget to subscribe to my channel, press the bell icon button. Thank you!